Welcome to today's webinar about the Parent Education and Advocacy Learning Center, known as the PEAL Center, provided through a collaboration between the Pennsylvania Medical Home Initiative, a program of the Pennsylvania chapter of the American Academy of Pediatrics, and funded by the Pennsylvania Department of Health. This webinar, led by Janine Brinkley and Kelly King, aims to describe the ways the PEAL Center and the Pennsylvania Medical Home Program collaborate to support authentic family engagement. It lists services that the PEAL Center provides and ways to access the PEAL Center resources, as well as describing how the PEAL Center educates and empowers families, professionals, youth, and young adults. My name is Dr. Renee Turchi. I'm a pediatrician at St. Christopher's Hospital for Children and the medical director of the Pennsylvania Medical Home Initiative at the Pennsylvania chapter of the American Academy of Pediatrics. This webinar is being recorded and will be available upon request. And please be advised that none of the speakers today have any disclosures. Please note that the information presented in this webinar is educational in nature and does not necessarily represent the views nor the policies of the Pennsylvania chapter of the American Academy of Pediatrics or its funders. It is my pleasure to now introduce our presenters for today's webinar. Janine Brinkley brings to the PEAL Center more than 3 decades of expertise in inclusive practices, special education, and supporting school teams to transform service delivery, as well as personal experience supporting family members with disabilities. As Executive Director of the PEAL Center, Janine oversees the statewide organization which provides information, resources, and training, as well as individual assistance to families, teens, young adults, and professionals. For most of her career, Janine has served in state-level technical assistance roles focused on inclusive education, systems change, positive behavior support, and interagency coordination. In this role, she helped to implement the Gateway System Change Program, PA's first statewide effort to move towards inclusive schools. When the Gaskin Settlement Agreement happened in 2014, the Bureau of Special Education asked her to take on the coordination of the implementation of the settlement activities. Prior to her retirement from the PA Training and Technical Assistance Network, known as PATAN, Janine had the privilege to collaborate in conceptualizing and implementing Project MAX, PA's state professional development grant focused on building capacity in schools to maximize access to grade-level general education curriculum for learners with complex instructional needs. Janine joined the PEAL Center in 2017 and is leading the organization with a vision and passion for social justice, the belief that all people with disabilities are valued members of our schools and communities. Also presenting today with Janine from the PEAL Center is Kelly King. Kelly has coordinated PA's Family-to-Family Health Information Center for several years. Having attended nursing school, teaching and working in the behavioral health field, as well as being the parent of special needs children, this gives her a unique blend of education and experience to assist families of children with special health care needs. Kelly has served as a parent partner in the medical home pediatric practice, facilitates a support group, serves on local and state committees to offer the parent perspective, and in her role as the Family-to-Family Health Coordinator, she has provided training and assistance to families and professionals across the Commonwealth of Pennsylvania. We are so delighted to have Janine and Kelly on behalf of the PEAL Center present with us today. Janine and Kelly, at this time, you may begin your presentation. Thank you for being here with us today.
Well, you're very welcome, and I need a shorter bio. I apologize. I didn't realize it was going to be read in its entirety, but thank you very much. And I'm happy to have Kelly here. I'm in Pittsburgh at the PEAL office here, and Kelly has a home office. So and you guys are in another place. It's the wonderful beauty of technology. So let's just share with you a few of our objectives. We're hoping that you will at the end of this webinar, be able to describe how PEAL educates and empowers families, youth, young adults, and professionals, to explain ways that PEAL can help families that you guys serve in your practices, to examine ways that PEAL and Medical Home Initiative collaborate, and to be able to access PEAL healthcare resources and share that information with families. So I want to mention we have a very robust website. The email address is on here. We have our healthcare resources on there as well as education resources. So we encourage you to share that with any families with whom you work who might need it. So just a little bit about the PEAL Center. You heard in Renee's introduction of Kelly that we serve as the Pennsylvania Family-to-Family Health Information Center, abbreviated as F2F. and Kelly is our coordinator for that work. So she is the point person at Peel to provide support and training related to children with special health care needs. And as you all know, that often overlaps with educational needs. So Kelly does individual assistance and training and lots of other things. We also serve as the Parent Training and Information Center for the state of Pennsylvania. That's abbreviated as PTI, and that's funded through the Department of Education. Each state has at least one, and we are that center for the state of Pennsylvania. We are a family-led organization in that everybody who works at Peel is either the family member or parent of a child or young person with disabilities and or special health care needs. And that, I think, gives us a special perspective that we can empathize with families as well as share our experiences. All of our services are provided at no charge to families as a result of federal funding and donations, and we do serve the entire state of Pennsylvania. So, some of the things we do to assist, and then we have some great examples that we pulled together, primarily Kelly pulled together, that hopefully will show you how our work and the Medical Home Initiative work collaboratively, and we serve sometimes the same families, but we certainly provide similar kinds of assistance. But these are the things we do. We educate and empower families, youth, and young adults up to age 26 and the professionals who work with them. So we have webinars, we do trainings, face-to-face trainings, we do youth leadership academies and family leadership institutes, we do one-day mini-conferences, and we also do individual assistance. So, and our goal is to equip families with the tools that they need to advocate for their children and themselves. Many times families call us and they want an advocate, but what they really want is someone to help them prioritize, understand the system, help their youth become more independent, all those kinds of things. We definitely offer guidance in navigating those education and healthcare systems. We actually have a really great presentation that is entitled Navigating the Physical and Behavioral Healthcare Systems, because those can be very complex. And we really work to develop informed decision makers, both families and youth. And I'm going to move to the next slide and ask Kelly to talk a bit about our alignment with the MCHB core outcomes.
Great, thanks. I'm delighted to join you today. I'm really invested in medical home, having experienced the value personally of the medical home concepts in a medical home practice. So I love the work of medical home, and I'm really passionate about sharing those outcomes with families. As part of the core outcomes, medical home is a very important component. So in that work, we refer families to our medical home partners there at the Pennsylvania American Academy of Pediatrics. We also educate them either one-on-one or through training, and of course we always are willing and able to provide resources for them. And I've added some scenarios here of some recent issues that I've helped families with in the next several slides related to the Maternal and Child Health Bureau outcomes. And so I did get a call from a family who was moving into Pennsylvania. They had a child with some complex issues and a lot of subspecialists, and they were having difficulty identifying a practice that really felt could meet their child's needs and had those important components, which were reflected in the medical home concepts, that could really service their child and help them to juggle all the things they were having to tackle. So we were able to get some practices in their area and link them, and they're delighted with the practitioner. Those things are not unusual, and families that we train are not always seeing the value of medical home because they're in it and they just take those things for granted. So appreciate the work of our medical home practitioners who are doing it so well that it just seems like a natural part of their work, and that's ideal. It's also been a challenge for some families who are trying to coordinate the care of their child and or sometimes multiple children and having difficulty doing that. So the idea of a care coordinator someone in a medical home practice doing that for them has proved invaluable. Again, these are genuine scenarios of families that I have worked with to help, and in the medical home practice, they're meeting with more success in having to deal with the challenges of day-to-day life. You can only imagine having any number of children and trying to do that work yourself. So it really helps if somebody else can help to share that the load with them and tackle some of the things that they need to do with their families. The next issue is having adequate insurance, and it's important that families are able to understand what's available to them to explore what those options are. The system in Pennsylvania generally works pretty well for families because of Pennsylvania's medical assistance being available to children with special health care needs who meet the Social Security criteria for a disability under PH 95. But it can be a challenge for some people to understand how those systems work together, how to do the application. Can be frustrating. We don't have the shortest application in Pennsylvania. And then making sure that the insurance coverage is actually working to the best needs of your children, and sometimes multiple children, and having to choose different managed care organizations to best meet their needs. So that can be cumbersome to a family who's already dealing with children and youth with special health care needs. And then there are times when insurance doesn't effectively work for families, so navigating, finding tools to help that family it's wonderful that we have our special needs unit. Even then, sometimes there are challenges, and we need to refer those families to the state when things aren't working smoothly for them. But there are those resources, and we're able to help the families with those. And, you know, it's not unusual that I get calls from families who have never been made aware that PH 95, medical assistance for our children with special health care needs, is available. That often happens when a child is diagnosed later on, perhaps a child with a mental health condition or autism that's diagnosed later. And so these families have often had to pay excessive amounts for health care coverage, co-pays, et cetera, and just were not aware that that was even an option for them. And again, I've already mentioned the special needs units, so they're valuable things to know, but somehow families aren't always aware that they're even out there. So love to do linkages to them and refer families to the special needs unit. The next core outcome that we have to work through is screening. And of course, as you know, that doesn't happen once and then it's done. While the newborn screening is you know, a valuable first step, we have to identify the things that families need to follow through with, and we don't necessarily share the Bright Futures periodicity table, but the components of that, the developmental stages that a child goes through, lots of the Bright Futures tools are helpful for families to kind of keep a pulse on where their child is. Families go into the physician, and the pediatrician's questionnaire or questions, they may tend to answer in a very positive way, and yet they may have concerns that they're not sharing. So understanding those developmental pieces and what's appropriate can be really powerful for a child. I sometimes get calls from early intervention providers, or preschool providers rather, who are seeing things in children and want to navigate having that conversation with a family, or perhaps the family is resistant to hearing their concerns, and talking to another family may be very helpful. So if they can get the permission of the family, or they give them my contact information, we can begin a conversation and just, you know, putting a little toe in the door about the possibility of their child needing screening for a condition that hasn't been identified. So again, we educate people as always. working to connect families with other organizations who might be helpful with the screening that may be, interagency because of behavioral issues or mental health issues that have happened, and they've intersected with problems with their child and they need some additional supports. And then, sometimes it is really difficult to figure out what's going on and getting a clear picture and connecting the dots. Families are sometimes referred to children, youth, and families because they're trying to get to the bottom of what the problem is with their child, and maybe, diagnostically the dots are just not connecting. So just helping them to navigate situations like that, that's just one example among many. And so I recently had a call from a family with a child with features of autism and no diagnosis. And while they've been concerned and people have mentioned that across time, that hadn't been diagnosed. So it's not unusual that the family would be directed, or it would be suggested that they seek an evaluation or looking for behavioral health services outside, and then certainly a medical diagnosis of autism, because the educational and medical identification of a child on the spectrum are slightly nuanced. So those are not atypical. Again, mental health conditions are sometimes difficult for families to connect the dots with, and then behavioral challenges that the intensive behavioral health supports may be required or may be beneficial for that family to access. So we also get calls with children more and more who have been identified with genetic conditions. One situation recently with a particularly rare condition, and they were actually trying to find connections with other families, and so we were able to connect them to Parent to Parent of Pennsylvania and the National Parent to Parent, and they did actually find another family and actually another provider who was working with a child with a condition. So that was really helpful in kind of a well-rounded way to find not only another family but another practitioner who was working to improve the life of that young person. The next area through the maternal and child health outcomes is decision-making and partnering, and this is really where the family engagement comes in. So families should not be intimidated or fearful when going to a practitioner. We want them to be empowered and see the family and the youth as partners in the healthcare system, because it's their healthcare, it's their life, it's their future. And so partnering represents more than looking at the doctor as the expert, which isn't typically what we're seeing in our medical home practices. And so we love to move the entire profession to looking more as the empowerment model, where parents are treated as knowledgeable about their child and they're equal partners in making choices. And then the youth, as they grow and are transitioning to be responsible for their own care, that they would be treated as somebody who's an equal partner in their care going forward. So it's important to think about how families can get the most out of their visit with the doctor. And so sometimes we're just thinking through with the family, preparing for a visit, writing their concerns, writing their questions, thinking about what it is they want to discuss with the doctor in advance to make the most of that opportunity. So recently had a situation with a youth and family who were talking about the discussion of pros and cons of a surgery. This individual had connective tissue disorder and pectus, and was having trouble with some of the activities that they were doing, and they had seen all the various subspecialists, and we're still having trouble with their situation, so they were considering a surgery. But there were, it wasn't just, we're going to do this corrective surgery and then everything will be wonderful. Unfortunately, there were, some serious potential cons to that. So we just had a discussion about what that situation, what that conversation with the doctor might look like, and thinking about that decision going forward. Of course, that was, important that the family and the doc have that conversation and the surgeon be involved. But it was helpful for the family to think about it prior to the discussion with the doctor. So, I just want to point out that little quote that I put at the bottom, never discount the parents, because our relationship is a lifelong one. It spans our lifetime at least, and we are the ones that are truly invested. So that's powerful to a parent, to feel that doctors are hearing, listening, and responding to their concerns and requests. And in my experience, that's always been very positive in the medical home. So the next area in the maternal and child health care objectives is transition. And so we all know that youth don't stay in the pediatric practice forever. So it's important that parents and youth begin to turn the table so that it's not the parent who's necessarily driving healthcare, but the young person, as they age and are able to understand their own health care, they become empowered to make choices that they're able to. So the parent becomes more of a coach or a supporter, and the youth drives their health care, that they begin to own their health care, and the parent stands in the background and continue to, as I said, support and then train them, because there are important things. I mean, it's great for the young person to be able to pick up the phone and make that appointment and hand over the insurance card, because those are things they're going to have to do in future. So asking questions about what that transition looks like of the healthcare provider, and then getting the buy-in from the provider and the medical home team to make that successful transition to adult healthcare. And a piece of that, of course, is the ops memo, and understanding that the young person has the ability to, quote, try out an adult healthcare provider as a consult while still getting services and being linked to the pediatrician. That is huge. It's sometimes very difficult for young people with special health care needs to make that transition. They've established trust with the pediatrician. They're comfortable there. So trying out adult docs is really beneficial for them. But unfortunately, lots of people are not aware of the ops memo, of the understanding recently that even some of our special needs units don't understand how that works, and that's a possibility for young people. So it's important for our professionals to be aware of that. And then sometimes it's a real challenge in this first scenario, a family in a rural county looking for an adult doctor. They were particularly looking for one who had some experience in the developmental and medical challenges that their young person had experienced. And in rural counties, there just are limited numbers of individuals, and finding somebody who's receptive to taking perhaps a nonverbal individual with autism who's challenged with behavioral issues can be difficult to find just the right person to serve in that way. So again, the ops memo is a wonderful thing to be able to try some of these docs and see how that's going to work for you and your family. So we're able to find a couple of options for that family and give them some resources to help them out. Another family transitioning into adult health care and having struggles with that. The young man had an epileptic episode, seizure in a work environment using some type of a checkout device that scans items, and he had more than one. He did get a diagnosis of epilepsy, but in trying to make some changes to his medication, he was a college student, had some difficulties because he was no longer allowed to drive. Then, getting connected to the adult doc to get the medications he needed proved a challenge, so he actually went back to the pediatrician and got what he needed because he felt more comfortable and confident in the pediatrician to meet his needs. So again, working hand in hand as that transition happened was really life-saving for him, and he was delighted that that option and opportunity were out there. The next area in the outcomes is community-based services. And of course, we can brainstorm with families and make, connections, but part of this is about empowering families. So I worked with a family once whose young son was on the autism spectrum, and he liked to go to the neighborhood pool and would stand in one particular spot because he liked watching people come in. Well, most people were okay with that, but one of the new lifeguards or responsible individuals there was uncomfortable with that. So, educating that person that worked there, supporting that family, really was about empowering the family to have this discussion with the folks there and educating that individual and understanding, what the purpose of their child standing in this spot was, and really wasn't a big deal. The person just didn't understand. I have recently had a conversation with a mom and dad who had planned to move here from Florida, and they weren't aware of what Pennsylvania had to offer. So I've had some lengthy discussions with them, and we'll get another family in one of your practices in the near future, I'm certain, because their young man has some complex medical conditions, and they were really impressed with the concepts of medical home coming from our rural Florida community. Another family in one of the counties that neighbors mine was in need of building a fence. This young man additionally had an autism spectrum disorder and was able to get out and get in some unsafe situations, and their county's regulations prohibited a fence of a certain height, so they actually had to work to get a variance so that they were able to build a fence that was higher than was permissible, so that they could safely let their child out into the yard, and that worked successfully. Things aren't always successful, but we do the best we can. And then, while this isn't a specifically identified Maternal and Child Health Bureau objective, the work of the Peel Center is primarily known for helping families with educational issues. But if you've got a child with special health care needs, of course, they have to be educated. So a lot of what I do is helping families and professionals who work with children with special health care needs understand and navigate systems that intersect. So where education and healthcare come together, and sometimes we're having conversations with nurses in schools, sometimes we're working on individual healthcare plans, thinking outside of that healthcare plan and making sure the healthcare plan or the 504 actually meet the student's needs. Sometimes our young people with special health care needs face attendance and truancy problems because they have had to be out for surgery, or their condition does not enable them to get to school. So, what does that look like? What can we do about that? How can we get around the truancy, issues, and what does that whole process look like? And then, addressing that with the school so that those problems don't exist. But on the other side of that is, how does the student actually get access to their instruction when they're not able to be in school? And I've already mentioned, nursing. Our nurses in school are very busy with all of the students that they have to attend to and all of their responsibilities. So sometimes this is, coordinating with outside nursing agencies who might be serving the student in the situation, and then medications administration. Recently had a situation where a student needed a medication that was believed to be something that the school wasn't able to administer, and we were able to successfully get them some information to educate them that they were able to administer that medication. Again, healthcare plans, which could be epilepsy action plans, could be plans for individuals with diabetes or asthma action plans, or nuanced plans based on the disability of the young person. And I do help families and nurses in school to think about those, write them with the family, get docs to take a look at those and make sure they've been, covering the things that are necessary for that individual, and then introducing those to the school. But it doesn't always think of the importance of a health care plan. And then I'm also a licensed behavior specialist in Pennsylvania and have had some work in the behavioral health field, work with the mental health professionals and behavioral teams in an interagency type of a model to help the student get what they require and what their needs-based in and out of school. And of course, those always intersect with school because we want all of the systems to be cooperating together in the child's best interest. And then, of course, families need to be engaged, need to be active decision makers and informed decision makers in both the education and healthcare. So their voice matters, and it matters in a very huge way, and that can make a difference. And sometimes our families are not aware. Sometimes they just need to be empowered, so I can work with them to help them to be more empowered, to be more engaged in working with those systems. And then, of course, not all of our students with special health care needs have the IEP or the 504. Sometimes we're working on requesting an evaluation if the family feels that's appropriate, and or thinking about how that can be shaped up to meet the needs of the student, or developing that, and we can have those discussions with them. So my little visual there is just all these intersecting spots. And so we're talking about whole people and all of the pieces of their life. The next slide actually shows the Maternal and Child Health Bureau initiatives, and I think about that too. It's really all these areas that intersect, and that's true in the life of any individual in any family. But working together with the Title V programs as our medical home team here in Pennsylvania, we can really leverage our impact, and it makes sense. It allows for more efficient use of our resources, and it gives a lot of perspectives, and the holistic approach, which I think with my picture of the intersection is what I was thinking about. We're whole people, we're whole systems, and we need to work together to most efficiently meet the needs of our children and young people who have special health care needs.
Okay. Kelly, I'm just going to go back to this slide for 1 minute to let folks know that we are in the process of developing some one-page informative resources on some of these topics, like attendance and truancy, nursing, medications, and healthcare plans. So we'll have those available on our website soon, and also they'll be translated into several other languages. So, if you have families who have concerns or questions about those areas, please send them to our website or have them contact us for help.
Additionally, we're also, working to, in the next several months, add some additional information and some additional resources to our PEAL website page. And those pages for the healthcare topics are arranged according to those Maternal and Child Health Bureau objectives. So hopefully it will help you to find things. And if you can't, never hesitate to call us.
So we really, at PEAL, our services take the form of 6 different sort of buckets. So we develop and identify tools and materials to increase the knowledge and skills of families, but we also find tools that are already developed and share them. And sometimes what we'll do is take information that's really important for families to understand and reframe it in a family-friendly way rather than in a more academic way, or if it's designed for professionals, and pull out some of those key points. We do weekly e-blasts, and if you're interested in receiving those and again forwarding them on or posting them in a place where your families go, all you have to do is go to our website, and the first thing that pops up asks if you'd like to be added to our e-blast list. And there are usually 4 or 5 items in those, and we have some education items, some healthcare-related items, some youth-focused items, and we try to also emphasize some resources that are available in Spanish whenever we can. And then on our PO website, we have a calendar of events that are occurring in various places across Pennsylvania, both PEAL-sponsored events and then events sponsored by other partners. And as Kelly mentioned, we have our healthcare page, and a link to that page is at the bottom of this slide. We do get a lot of traffic on our website. We find that the more robust resources we have there, then we end up working with families who have really complex issues, because the easier issues, they're able to find the resources and resolve themselves. So the next thing we do is we provide individual assistance. We do that via phone, via email, and occasionally in person. We do things like review a document and provide resources. And Kelly shared a lot of examples of her individual assistance tied to the MCHB outcomes in our previous scenarios. And we do help them access high-quality coordinated health care. The individual assistance is available in Spanish. We do have a bilingual parent advisor, and also we use Language Line for other languages.
And just so you know, our bilingual parent advisor was also a parent partner in a medical home practice. Again, she has a young man with some complex medical issues, so she's able to help those families who are Spanish-speaking, and again is very invested in the medical home concept.
And she's actually listening in today. So hi, Anna, and we're glad you're able to be on. We do a lot of training for families, youth, young adults, professionals. We look to try to build knowledge of best practices. For example, yesterday there was a summit out here, and we had an exhibit table, but we also did a session on for youth and their families on how networking can support them in an effective transition from school to adult life. And we have a number of trainings that are also available in Spanish. We also like to, when we do our trainings, we really try to reach, one of our charges is to reach underserved or hard-to-serve communities. And in Pennsylvania, we have underserved rural communities, and then we have in urban areas underserved or hard-to-reach communities. So it challenges us. We only have a complete staff of 16 here at PEAL, and Pennsylvania is a big state. So we use web-based presentations when we can and try to record things and provide things in various formats as well. And then leadership development, I think, is one of the really unique things we do. We have family leadership institutes, and this is a place where we do collaborate with the medical home folks. They always come into our family leadership institutes and share information about medical home, and we have some activities. We help the participants learn about the different characteristics of a medical home practice, and they always are eager to learn and ask a lot of questions of Renee and Eileen, whoever does that with us. We also provide intensive youth leadership development. So we do youth leadership, these are actually called academies. We just did one out in Delaware County with Interborough School District. We did one in Philadelphia and one in Pittsburgh this year, and we have some additional ones coming up planned. And the focus of those is to, again, empower youth to understand more about themselves, write goals, become aware of community services, and we get a lot of positive feedback from those as well. And then we use partnerships. We really try to build bridges across agencies and organizations and systems. So with healthcare, you can see the long list of organizations and individuals that we connect with. Education, advocacy, and family groups. So Kelly mentioned she sits on some different organizations or different statewide groups like tell me what EDHI is again, Kelly, you sit on that?
Early hearing and detection.
EHDI, sorry. But it's really, we think PEO, one of our jobs is to really try to bring that true family perspective and to support other families in learning how they can participate in decision-making groups and help make a difference in their communities. So that is just a list, and I think we're almost to the end. Yep. We are a little early. Eileen, I don't know if anyone has any questions, we'd be happy to answer them. Or if you and Renee have any other comments you'd like to make, please feel free.
That's great. Thank you, Kelly and Janine. At this time, we're going to open it up for questions. You can type your question in the Q&A box, or if you're on the phone, you can dial #6 to unmute your line. So at this time, we'll take some questions. Again, that's #6, or you can write your question in the Q&A box. You know what, Janine and Kelly, I was thinking maybe you could talk a little bit more about that Family Institute training and how you do it both in Pittsburgh and Philadelphia, and how you're able to find families to participate in that.
Sure. Kelly, do you want to take that one, or do you want me to start? Well, I'll take that as I'd like to start. What we do is we partner. The Family Leadership Institutes are 3 two-day sessions, usually one a month for 3 months. We do them on a weekend, generally a Friday evening and Saturday. It's a total of about 30 hours of family leadership training. We updated the curriculum fairly recently, and we have a nice merging of healthcare, education, and then overarching things like serving on groups and communicating effectively that help families in any situation, regardless whether it's healthcare or education, where they need to advocate for themselves or their child. We then partner, so we identify a geographical region. Well, actually, the last one we did in California, PA, which is out here in southwestern PA. We did one in Erie, we did one in Philadelphia, and each time we identify a couple of community organizations in that area who can serve as partners with us, and they help us, and then Medical Home Initiative also partners with us to do those. Pennsylvania Health Law Project comes in and shares some information on waivers, and MA, which is always a learning experience for families. Excuse me. And then we recruit families through an application process. We take a maximum of 25, and it's been really great. The last 3 we've had some fathers participate along with mothers. We had some grandparents participate. We try to get a diverse audience, and we cover all of the costs. So we provide a hotel room for the families. They can bring their children with them as long as they bring someone else to care for the children during the sessions. Families join us for meals, and we reimburse the families for expenses that they incur traveling. On the one we did in Philadelphia, we translated the entire thing. We had 2 women participate, and they were primarily Spanish speakers. And so we have all the materials that we use for that translated into Spanish, and we used real-time interpretation to let them participate. Families usually at the end of it ask if they can have more. We wish we could do more. And the other thing they do is they identify an issue. So they identify a challenge, an issue, something that would, if it were improved, would impact not only their child but others in the community. Kelly mentioned truancy earlier. One of the stories we share is about a family who's had a couple of young people who were being charged with truancy, but it was related to their health issues, and how the mother advocated for changes that actually resulted in changes in state legislation. We had a police officer from Philadelphia participate, and his project, he went back and worked with the administration to put together resources that are available to any Philadelphia police officer who is dealing with a child who has a disability or special health care need. So that's one of the things that we think really helps make a difference. And then we also are doing some follow-up activities with those families. We're actually really excited. We're going to be doing a Family and Youth Leadership Symposium in May for family leaders across Pennsylvania, and bringing those folks together in Harrisburg for a Friday, Saturday event where they have opportunities to, we have some keynotes, we have a panel of fathers, we have a panel of non-traditional caregivers, and we also have some focused youth and family sessions. So we're hoping to get about 100 family leaders together there and boost their skill set a little bit more and connect with them.
And this is Kelly. I apologize. I tried to unmute earlier and wasn't able to do so. I believe, Eileen, you asked about how we identify the parents participating in that. So not only do our partners help us to identify that, we share that information through our e-blasts and our listserv, but our partners help. So we would be more than happy if any of the practices are aware of families or young people who might benefit from the summit that Janine has identified. We can share that information with you, Eileen, and again, in our wonderful partnership, you can certainly share that with the practices if they have someone they feel might be able to participate in that.
That's a great idea, Kelly.
That's great. Thank you both. So again, if anyone has any questions, you can write it in the Q&A box or hit #6 to unmute your line. Okay, I guess at this time we're going to conclude our webinar. We want to thank Janine Brinkley and Kelly King from the Peel Center for their excellent and informative presentation. Again, many thanks to the Pennsylvania Department of Health for the funding that made this webinar possible. We all hope you have a great day. Thank you so much.